In this video we are going to see about the epistaxis. Before going to the epistaxis, we need to know about the blood supply of nasal septum. The nasal septum is supplied by 5 arteries mainly. You can go from this. First go with the internal carotid artery and external carotid artery. This external carotid artery, by giving two branches, internal maxillary artery and facial artery. This facial artery gives a branch known as superior labial artery. This supplies this anterior-inferior part of the nasal septum. Then the internal maxillary artery gives two branches. The two are you can remember as palatine branches. The greater palatine artery above the greater palate, and the sphenopalatine artery in the sphenopalatine recess. Okay, recess. You can remember this very easily. It supplies the posto-inferior quadrant. Then the internal carotid artery gives two branches. Anterior ethmoidal artery supplies this anterior ethmoidal area or bone. Then this ophthalmic artery supplies this area known as branch known as posterior ethmoidal artery. You can see here all arteries, branches of the arteries meet here. This is known as little area. All branches, superior labial artery, greater palatine artery, sphenopalatine artery, anterior ethmoidal artery, except posterior ethmoidal artery, everything meet. So this area is prone to get traumatized by most commonly nasal picking. This causes anterior epistaxis. Then there may happen posterior epistaxis, but these are not due to arteries, it's due to venous plexus. It is in the posterior to inferior terminator. You can inferior terminator will be here, so it will be posterior to inferior terminator. This is known as Woodruff's plexus. Here it is supplied by sphenopalatine artery and posterior pharyngeal artery. You may think this is you said venous plexus, but you're saying sphenopalatine and posterior pharyngeal artery because this venous plexus, the small venules receive major blood supply from these arteries or sphenopalatine and posterior pharyngeal artery. Okay, present on the lateral wall. Okay, so if you ligate these two arteries, the bleeding will automatically stop. But okay, then you should know the most common causes are in elderly during winter season or autumn season. Then NSAIDs, then alcohol may cause this posterior epistaxis. Okay, then let's go into the management of epistaxis. The little area is the medial wall. The posterior epistaxis of Woodruff plexus is present in the lateral wall. Okay, then let's go into the management of epistaxis. First, management of anterior epistaxis. Okay, it is this epistaxis occurs anterior to the piriform aperture. That is means the large hole or before the bone. Okay, so it is due to nose picking so the treatment is nose pinching for 3 to you should apply pressure for 3 to 5 minutes on the cartilaginous part. It will be stop in 1 to 2 minutes after the bleeding time is over. Okay, this is known as Trotters method. But in case of child with recurrent epistaxis, you should ligate this artery with a chemical cautery. Okay, or electrode cautery. In these conditions, this acidic during cautery, this acidic will cause a coagulative necrosis of the artery and it will close the artery and it will cause stop bleeding. Okay, but in case of a child puts basic alkaline batteries in mouth, it causes liquefactive necrosis and causes very deep injury. It may lead into complications. So if a child is found with the button battery in nose, it should be removed as soon as possible. Whatever you should do, then you should do. Okay, then posterior epistaxis. Here the bleeding point is not visible. Okay, we can't see the bleeding, but we can the patient will say the blood is coming from the posterior. We cannot see the visible point, but the blood will be coming. Okay, so the first treatment of is the electroscopic electrocardial ligation. 80% of the cause will be cured by this. Okay, by this. Then if very profuse large amount of blood is losing, you should do the anterior nasal packing. Okay, this is the anterior nasal packing. You can see here anterior nasal packing. Then if it also bleeding is continuously coming, then you should do the bilateral nasal packing. If it also don't work, you should do the posterior nasal packing with the Foley catheter. Okay, you should pass a balloon catheter with the this is known as Foley's catheter. Then you should tie a cotton swab and you should place this in the posterior nasopharynx most commonly. Okay, or posterior part of the nasal bone nose. Okay, if also not responding, you should do the combined classical anterior plus posterior nasal packing. Okay, nowadays the epistaxis catheters, the balloon catheters are came, so it's very easy to do. You can see easy to do the nasal packing. Very important thing, if these also don't work, we should do the internal maxillary artery or external carotid artery ligation. How you can do this internal maxillary artery ligation is that you can do in both ways. You can go with the transantral approach or transnasal approach. This is the transantral approach. This operation is known as Caldwell's Luke operation. Now you can ligate the internal maxillary artery, but you can also ligate external carotid artery. That's all about epistaxis. During this operation, very important step, this first you should go break into the anterior wall of antrum, then you should break the posterior wall of antrum, then you may enter into the pterygophallentine fossa. In there you can see and ligate the internal maxillary artery, but you should be very strict, very what we can say, you should be attentive to it, but because you can cause injury to the infraorbital nerve. It may cause complication like oroantral fistula. Okay, that's it for this epistaxis.